Hi everyone. Today we'll be presenting the MicroviruS, a novel diagnostic risk assessment tool for multiple sclerosis.
Multiple sclerosis is a chronic autoimmune disease where the immune system, more specifically autoreactive lymphocytes, attack the protective myelin layer of nerves in the central nervous system, resulting in inflammation, scarring, and lesions in the brain and spinal cord. As a result, signals from the brain are interrupted or even completely disrupted, resulting in a wide variety of symptoms from impaired mobility to impaired cognitive function. Canada has one of the highest rates of MS in the world, with approximately 90,000 Canadians living with the disease. This is a major issue as there is a lack of risk assessment tools for asymptomatic individuals. Recent studies have shown that the increased frequency of specific microRNA and herpes viruses such as EBV and HHV6B is correlated with MS activity. Moreover, the co-expression of these biomarkers have been significantly associated with MS prognosis. Our product will utilize these novel biomarkers for MS risk assessment.
A patient may visit their physician for an annual checkup where the physician can suspect an increased risk of MS based on specific demographic data and environmental risk factors, such as being a female, smoker, lack of vitamin D, and live further away from the equator. In this case, the physician can request our diagnostic risk assessment tool, MicroviruS, to test for genetic predispositions to MS. The physician will require to take a blood sample from a patient by simply drawing blood into a vial from a large vein in the arm, similarly to a routine blood test. This blood sample will be transported to a pathologist, where the MicroviruS kit will be sold containing the appropriate reagents and primers required to detect for specific viral and microRNA biomarkers using one-step reverse transcription quantitative polymerase chain reaction. RNA will be isolated and digested with a deoxyribonuclease 1 kit to eliminate any possible DNA contamination, followed by reverse transcription with an OmniScript RT kit for the viral genes and a TACMan Advanced microRNA cDNA synthesis kit for the microRNA. Finally, the samples will be amplified with the appropriate reagents and gene-specific primers using a thermocycler to detect for HHV6B, EBV, and microRNA 128-3P expression in duplicate. A standard curve will be prepared with commercially known amounts of HHV6B and EBV to determine the absolute quantitation, and microRNA 425-5P will be used as a normalizer for microRNA 128-3P relative quantitation. The amount of HHV6B, EBV, and microRNA 128-3P expression will contribute towards a patient's viral and microRNA biomarker profile, which will be sent back to the physician in order to determine the necessity to devise lifestyle interventions to mitigate the risk and prognosis of MS.
But why is there a need for MicroviruS? Well, there are currently no pre-screening tools for MS that are inexpensive or non-invasive. So this tool could be used to recommend lifestyle interventions which reduce disease severity and onset. Normally, patients with risk factors or a family history present with neurological symptoms, after which a doctor can order a test like an MRI or a spinal tap to contribute to an MS diagnosis. However, the age of onset is around 30, and before this, there's really no screening tool for at-risk patients who are not symptomatic, despite there being evidence of several risk factors for MS, such as family history, smoking, vitamin D deficiency, or living far from the equator, and so on. So we really saw that there was a gap here, and that since there's no screening tools for patients who are not symptomatic but have a high risk for MS, that this was a niche that needed to be filled. With MicroviruS, patients in their teens or early 20s who physicians consider to be at a higher risk can be tested for their viral or microRNA profiles to help gauge their risk for developing MS. Since viruses and microRNA are emerging risk factors that are heavily associated with MS, physicians can recommend modifiable lifestyle interventions like smoking cessation, vitamin D supplements, or exercise. And although, for example, smoking cessation may not completely stop MS from developing, research has shown that smoking cessation can significantly impede MS progression and severity. So how would this play out in a clinic? Tammy is 22 years old and has a family history of MS. She smokes and lives in Canada. She meets with her doctor for a routine checkup, and he notices that she has a higher risk for MS based on these risk factors. Her doctor encourages her to provide a blood sample to be sent to a lab where a MicroviruS test will be conducted to characterize her viral and microRNA profile. Days later, Tammy goes into the clinic and her doctor explains to her that based on the presence of herpes 6 and EBV in her blood, her risk for MS was even greater than previously thought. He recommends she immediately stop smoking because if the disease were to develop, smoking cessation could be protective in terms of disease onset and severity.
So with that said, what exactly is the goal of our product and its results, and how will it benefit the public? Well, as previously mentioned, the MicroviruS assay serves as a diagnostic tool to assess the risk of MS for individuals who may be predisposed to a higher chance of developing the disease. And it is important to note that traditional diagnostic methods include lumbar or spine punctures, electrical activity tests on brains, and MRIs, which can be expensive or invasive. So the physician will give their patients this test, and if the results come back to reveal that the patient has a high expression of HHV6, EBV, and microRNA 128.3p, then the physician can recommend certain lifestyle interventions or other methods to help reduce the risk of their patients developing MS. If the results of the test reveal a low expression of these factors, then it will suggest to the physician that there is a lesser need to recommend more invasive and more expensive diagnostic methods. Ultimately, we hope that our product brings to the public an affordable, relatively quick, and non-invasive diagnostic test for MS risk, which can save healthcare workers and patients a lot of time, money, and the need for further unnecessary resources.